Today's podcast is sponsored by strawberry.me. As I start looking forward to a new year, I like to reflect back on what's working and what's not. And one thing that's not been working is that I have completely fallen off with my daily routines. And that is definitely something I want to fix in 2025. So if you also find yourself looking for ways to improve, then a personal coach from strawberry.me could be the turning point you need to get you there. And if you're not sure about this whole coaching thing, here are some ways coaching can help. First off, a coach can help you gain clarity about what you truly want, and they can also help you set goals that are specific and achievable. They can also help you come up with a plan and be there for you when things get tough. What I've loved so far about Anne, my coach at strawberry.me, is how well she listened to my needs and was able to help me identify what's most important to me. Plus, the solutions we came up with feel completely doable, and I can start implementing them right away. I can't wait to see what I can accomplish over the next few months. Get started today. Visit strawberry.me/nursemo and take a short quiz to get matched with the perfect coach. Plus, you'll get 20% off your first month. That's strawberry.me/nursemo. Well, hello there. I'm Nurse Mo, and this is the Straight A Nursing Podcast, where I teach concepts and share tips so you can thrive in nursing school and at the bedside. Today, we're talking about right-sided heart failure. And before we do that, of course, I have to take a minute to thank my listeners. And this listener shout out goes out to Anne, who says, "Hi, Nurse Mo. I just wanted to let you know how much I appreciate your podcast and the other resources you provide nursing students and new grads. I started listening to the podcast when I was studying for my NCLEX, and now I'm listening again to prepare for my first job as a new grad. You explain everything so well, and it really sticks. Thanks again for all your hard work. I'll be telling all my nursing friends about you." And thank you so much for sharing your experience with the podcast and how it's helped you with NCLEX and as you prepare for your new job. I want to wish you all the very best in your nursing career. Alrighty, today we're talking about right-sided heart failure. So basically, let's just do a quick overview of what heart failure is. In heart failure, the heart has essentially lost its ability to adequately pump blood out of the ventricle. Heart failure can be classified as right-sided or left-sided, depending on which chamber of the heart is affected. And in most cases, right-sided heart failure is a result of left-sided heart failure. So in many cases, your patient will have heart failure just all around because both sides of the heart are affected. Though it can occur on its own, so right-sided heart failure can occur on its own as a consequence of other conditions. Patients with right-sided heart failure, which you might hear called right ventricular failure, are not able to pump blood adequately into pulmonary circulation. So let's take a quick look at some causes of right-sided heart failure. So as I just mentioned, most cases of right-sided heart failure are due to left ventricular failure. However, there are several other pathophysiological processes that can lead to failure of the right ventricle. So we've got respiratory conditions, cardiovascular conditions, and system-wide conditions. So looking at respiratory causes for right-sided heart failure, one is pulmonary embolism. And if you want to dive into the connection between pulmonary embolism and heart failure, go and listen to episode 341. And then I've also got an episode coming up in a few weeks on pulmonary embolism specifically, so keep an eye out for that as well. So again, a common respiratory cause of right-sided heart failure is pulmonary embolism. It can also be due to pneumonia, acute respiratory distress syndrome, or ARDS, and pulmonary hypertension. And then cardiovascular causes could be congenital heart disease, cardiomyopathy, tricuspid or pulmonic valve insufficiency, pericarditis and myocarditis, also cardiac tamponade, superior vena cava disease, and infarction of the right ventricle. And then some system-wide causes could be hypovolemia, distributive shock, amyloidosis, and sarcoidosis. And those last two are autoimmune disease. And I hope I said them right. Okay, so I've said a couple of times that left-sided heart failure is a common cause of right-sided heart failure. You might be wondering, how does this happen? So in left-sided heart failure, the left ventricle cannot adequately pump blood out into systemic circulation. So as a result of this, the buildup of blood, because it's not getting pumped out, right? It's kind of building up and building up. It causes pressure to increase in the pulmonary vasculature. When pressures inside the pulmonary vasculature are elevated, the right side of the heart has to work much harder to pump blood into the pulmonary vasculature. And over time, the right ventricle hypertrophies, and then it dilates, and this is essentially leading to right ventricular heart failure. All right, so now that you have a basic understanding of right-sided heart failure, let's go through all the key nursey stuff using the Straight A Nursing Latte method. So we'll start with the letter L. How does the patient look? What are their signs and symptoms? So patients with right ventricular failure can have the following signs and symptoms. 1, peripheral edema. This is a very common sign of right-sided heart failure. The patient could also have edema or fluid buildup in the abdomen called ascites. So again, we're looking at peripheral edema and ascites or abdominal fluid retention. Another is jugular venous distension or JVD, and I'll talk in a moment about how we are going to assess our patients for JVD. They could have shortness of breath and coughing, especially if that left ventricle is involved. They could have sudden weight gain due to fluid retention. They could have dizziness and fatigue, nausea and loss of appetite. They could have something called nocturnal polyuria, where they're getting up to pee multiple times a night, and hepatomegaly, which is an enlarged liver. So that is the key signs and symptoms. If you're studying for a nursing school exam, you're probably looking at, for the most obvious things that might be on an exam, looking at peripheral edema, JVD, maybe that abdominal retention, that fluid retention, weight gain, and possibly that shortness of breath as well. Alrighty, next letter in the latte method is an A for assessment. How are we going to assess our patient? So one of the most important and easiest assessments for a patient with heart failure is to weigh them. That's why, let's say you're working in clinical, you're on a unit with patients who have heart failure, you'll notice that one of their standing orders is for a daily weight, because sudden increases in weight can signify a heart failure exacerbation. So we're going to weigh our patient daily at the same time each day. Other key assessments include obtaining a set of vital signs, monitoring the patient for that edema, monitoring for JVD, and for shortness of breath. In addition, we're also going to assess the abdomen for signs of fluid buildup and hepatomegaly, which is again that enlarged liver. Now, earlier I mentioned JVD and assessing for that. So the basic way to do it is to place the patient supine at about a 45-degree angle and have them turn their head to the left. What you're looking for is a bulging or pulsating vein on the right side of the neck. So that's jugular venous distension. And you will see that when the patient has right-sided heart failure. I've seen it a couple times, and most recently it was so significantly pronounced that the doctor didn't even need to do any other assessment. He's like, yep, we got some heart failure situation going on here. and was able to quickly get the right treatments prescribed for this patient, and they ended up doing just fine. So assessment for a patient with heart failure, again, we're going to weigh them daily. We're going to get a set of vital signs. We're going to monitor for edema, look for that JVD, see if they're having any shortness of breath, any abdominal distension, any hepatomegaly. We're also going to do a full cardiovascular assessment, and this could reveal an audible S3, which is a third heart sound, or a tricuspid murmur. Remember, that S3 heart sound is a key indicator of ventricular dysfunction. You could also hear or actually see a right ventricular heave. And this is a visible, and you could also probably feel it, visible and palpable pulsation of the chest located just to the left of the sternum where that right ventricle is. It's called a heave. You might hear also called a lift. You could have a paradoxical pulse, which is a drop in blood pressure by more than 10 millimeters of mercury upon inspiration or inhalation. You might also notice some tachycardia with your cardiovascular assessment. Patient could have some hypotension as well. And if cardiac output is severely compromised, cool extremities with delayed capillary refill. The next letter in the latte method is a T, and that stands for tests. So before we hop into the tests for heart failure, let's take a quick break.
For over 50 years, Burlington's legacy has been great deals on coats for all weather conditions. So before you're caught unprepared for the winter weather, head to Burlington for name brands, quality items, and surprising fits for every family member. Stock up on coats, sweaters, and accessories before the cold hits, so you can finally stop avoiding the elements and start living comfortably. Warm up at your nearest Burlington location less than 1 mile away. Burlington. Deals, brands, wow!
So that next letter is a T, and that stands for tests. What kind of tests are we going to be using to diagnose or evaluate our patient? So one is an echocardiogram. This is an ultrasound of the heart. You might just hear this called an echo. Now this test will show the right ventricle's size. It will provide important data about its function and estimate pulmonary artery pressure. Now, this test can be conducted in one of two ways. Most commonly is a transthoracic echocardiogram, where the transducer is placed just against the chest wall. The wand emits sound waves, and this creates an image of the heart. Now, if we need more detailed images, we can get this from a transesophageal echocardiogram. Now, in this test, the transducer is introduced into the esophagus. And of course, when you think about it, the esophagus is much closer to the heart. So this is a more invasive test, more expensive test. The patient has to be sedated, all of that. So most of the time you're going to see a transthoracic echocardiogram, but transesophageal echocardiograms are pretty common as well. As a nurse that works in the recovery room, I take care of patients after their TEEs all the time. TEE stands for transesophageal echocardiogram. Now, another test utilized could be a simple chest x-ray. This can reveal an enlarged heart and show pulmonary congestion. An EKG could also be utilized. That 12-lead electrocardiogram can show if the patient is also suffering from any cardiac arrhythmias as a result of that failing ventricle. And then blood tests. Common blood tests for a patient with right-sided heart failure include BNP, which will be elevated, and tests to evaluate hepatic and renal involvement if those are present as well. An MRI could be conducted to measure right ventricular function and volumes, and then multiple gated acquisition scanning, or an MUGA scan, is a test that uses a radioactive substance to visualize the heart's structure and function. And then probably the most invasive procedure is a right right-sided heart catheterization. This provides a very detailed look at the heart, and it involves the physician inserting a long, very thin catheter through a major vessel, such as the femoral vein. And this catheter is then advanced all the way up through the vasculature, through the heart, and the cardiologist can take measurements from the right atrium and the ventricle and determine things like pulmonary artery pressure. A right heart catheterization can also provide an indirect measurement of cardiac output. Now, again, this is basically a surgical procedure. The patient goes to the heart catheterization suite, they get this done, then they are sedated for that or anesthetized for that. Then they come to the recovery room, have a regular, post-op recovery process. Some patients go home the same day. If patients that are sicker might be in the hospital for a few days, but this is definitely a more invasive, but also much more detailed exam. Now, the next letter in the latte method is another T, and that stands for treatment. So how is right-sided heart failure treated? In general, right-sided heart failure is treated by addressing the underlying problem. For example, if the right ventricular failure is due to pulmonary hypertension, medications that dilate the pulmonary vasculature can reduce the workload on the right side of the heart and help that right heart failure. Or if the right ventricular failure is due to hypovolemia, providing fluids will help the right ventricle function more effectively. General treatments for right-sided heart failure include 1. Fluid restriction. In some cases, patients with heart failure will be advised to restrict fluids, and this is often 1.5 or 2 liters of fluid per day. This will vary patient to patient, but that's a common fluid restriction. Also, sodium restriction. Since excess sodium leads to fluid retention, patients with heart failure should follow a low sodium diet, and generally that's considered to be no more than 3 grams of sodium per day. And then diuretics. A diuretic such as furosemide may be utilized to rid the body of excess fluid in volume overloaded patients. Now, care must be taken in individuals with right heart failure, since volume depletion can lead to hemodynamic compromise, but you will still see diuretics utilized, especially if the left ventricle is involved as well. And then ACE inhibitors or angiotensin receptor blockers, such as valsartan. These medications work by disrupting the RAS pathway and have been shown to decrease the risk of hospitalizations in patients with heart failure. Note that ACE inhibitors and angiotensin receptor blockers can cause hyperkalemia, so they're going to be used cautiously in patients with renal insufficiency. And then beta blockers, such as metoprolol. These medications cause decreased blood pressure and decreased heart rate, and have also been shown to reduce the incidence of cardiovascular mortality and hospitalizations in patients with heart failure. Then we have mineralocorticoid receptor antagonists, such as spironolactone. These medications block the effects of aldosterone and can also lead to hyperkalemia. So they are avoided in patients with renal insufficiency and may be avoided in patients taking an ACE inhibitor or an ARB. And when we block the effects of aldosterone, essentially spironolactone is going to act like a diuretic. Another medication that I learned about as I was researching for this episode is SGLT2 inhibitors. SGLT2 inhibitors. Now, you might recognize this because these are drugs primarily used to treat type 2 diabetes, but studies show that they can reduce the risk of cardiovascular death and heart failure-related hospitalizations. A common one is dapagliflozin, which goes by the brand name Farxiga. So if you see your patient is taking that, but they don't have a history of type 2 diabetes, look to see if they have heart failure. And then another key treatment is to support oxygenation. Individuals with an SpO2 less than about 90% or whatever the MD deems their parameter for that patient should be receiving supplemental oxygen as needed. All righty, last little bit here, and then you'll be a right-sided heart failure expert. E is the next letter in the latte method, and that stands for education. So, what are some key things you want to teach your patient about right-sided heart failure? You want to teach them about cardiac rehab. Teach your patient that cardiac rehabilitation can help slow the progression of the disease. And what this entails is medically supervised exercise programs and extensive heart failure education. You also want to teach your patient the importance of taking daily weights and how to do that. And that is just a key way that they can monitor their heart function. So you want to teach them to weigh at the same time each day and to use the same scale each day when they can, and that any sudden increase of 2 or more pounds in a day or 5 pounds in a week should be reported to their care team as soon as possible, as this could be a sign of fluid retention. You also want to make sure your patient understands how to monitor their blood pressure, especially if they're taking a beta blocker, an ACE inhibitor, an angiotensin receptor blocker, or a diuretic. You also want to make sure your patient understands dietary changes that can be helpful for them. Individuals with right-sided heart failure should follow a heart-healthy diet that is low in fat, rich in whole grains, rich in fruits and vegetables. They should also limit their sodium intake and avoid or limit alcohol and caffeine. And then other lifestyle changes you can teach your patient are to get regular exercise. If they're smoking, they should quit smoking. They should strive to get consistent sleep at night and manage stress through activities such as meditation or yoga. And you also want to teach them about staying healthy. Patients with heart failure should get their recommended vaccines, including pneumonia vaccine, flu vaccine, and COVID-19 vaccines. And last but not least, when to seek medical attention. Teach your patient to seek medical care if they develop worsening symptoms such as shortness of breath, that increase in their daily weight, any increase in their edema, if they're more fatigued than usual or dizzy or more nauseous. They should also seek medical attention for any signs of a respiratory infection, any sustained tachycardia, chest pain, or any changes in their heart rhythm. So there you have it, your quick overview of right-sided heart failure. I hope this has helped you feel more confident so that you can either take care of these patients with more knowledge or just feel like you're ready for whatever your nursing school exams or clinical experiences can throw your way. Thanks again for listening and sharing your free time with me today, and I will see you again soon. Bye for now. This podcast is brought to you by Straight A Nursing, a proud member of the Airwave Media Network. For more educational podcasts, check out airwavemedia.com. And for more nursing-related content, go to straightanursingstudent.com.
Americans love using their credit cards, the most secure and hassle-free way to pay. But D.C. politicians want to change that with the Durbin-Marshall credit card bill. This bill lets corporate megastores pick how your credit card is processed, allowing them to use untested payment networks that jeopardize your data security and rewards. Corporate megastores will make more money, and you pay the price. Tell Congress to guard your card, because Americans lose when politicians choose. Learn more at guardyourcard.com.